Mr Speaker, my question's addressed to the Minister for Health and Regional Health. Given Orange Health Services' role as a primary referral hospital for the Central West, will the government consider a surgical robot at Orange Hospital to expand surgical capacity? And how is the government reducing wait times and easing the pressures on busy emergency departments in my electorate?
I call the Minister.
Thank you, Mr Speaker, and very hard act to follow. Thank you, Mr Speaker, and I want to thank the member for Orange for his question, and also for spending some time with me out in his electorate recently. Had an opportunity to have some really good discussions with frontline services, including the Bloomfield Urgent Care Clinic out in his community, and I want to thank him for his advocacy. In addition to that, I think members of this place would know the member for Orange has been a tireless advocate for palliative care out in the Central West, and that is a challenge. We've been able to commence the expansion of palliative care services in Orange, on no small part because of his advocacy and the advocacy of the Push for Palliative community out in that area, and I want to acknowledge him for that, and also acknowledge him and the Mayor of Forbes, Phyllis Miller. She's a person known very well to this place. Her advocacy, along with the member for Orange, really secured additional funding for the new operating theatre that they'd been requesting at that hospital for some time, and it's important to acknowledge members across the divide on the work that they're doing in their communities. We are looking at robotic surgery. It is an important part of the way in which we deliver health services in clinical care going forward. Last week we released a clinical services plan, a draft clinical services plan for that part of the community. In that, we've made it clear that we will be assessing a business case, and a business case will be coming forward for consideration in the upcoming budget around robotic surgery. We want to make sure that we have a really close look at this. I've had an opportunity in this place with the member for Orange on now, I think twice, but certainly a number of times to meet with clinicians out in the Orange, from the Orange Hospital. It's quite a unique hospital. It is a part of the hub and spoke for the Central West. It attracts a lot of senior clinicians, and we need it to continue to do that because it provides services to some of those other communities, smaller communities, right across the Central West and beyond. And robotics, I see, as a part of the future. I also see it as part of an ability to continue to attract those clinical staff. So we will work through a business case, and we will work through that consultation with clinicians, and the member for Orange has my absolute commitment that we will engage with him on that process in a very transparent way and work through that issue. The member for Orange is also, I'm sure, aware that we're moving to ratios in his hospital around an additional 21.
Member for Orange? Additional 2 minutes.
An additional 21 staff, and that's an important part of what we're trying to do in very, very busy hospitals. In addition to that, we are focused on making sure that we attract and retain healthcare staff to the Central West and to that part of New South Wales. We are trying to do that through our regional incentive program, designed to make sure that we can attract and provide some incentives for those people and those clinicians and those healthcare professionals that we need on the ground. In addition, we are also investing in his electorate key worker accommodation. That is a particular challenge for healthcare workers, to be honest. Healthcare workers often make decisions about whether they're going to regional and rural New South Wales off the back of what type of clinical care and expertise they're able to provide a district. Secondly, what type of housing is available to them or their family. That's why we have a program of about $200 million targeted for regional and rural and remote key worker housing, and some of that is being delivered in the Orange community. I want to thank the member for Orange for his ongoing advocacy for health services right across his community and the Central West. We do have challenges. There's no two ways about that. We've been very clear about some challenges when we get further from our large metropolitan cities. We're working through those with all members across this parliament, and I want to thank everyone for their engagement in that process. But it is important to note that the member for Orange, particularly I'll say around palliative care and that operating theatre, he has done an enormous amount of advocacy, and it is important to acknowledge that in this place off the back of a community that's very active in relation to healthcare services, and we will continue to work with him to deliver the best healthcare services we can to the people of his electorate in the Central West.
Thank you.